Hey guys, it's coronavirus day 465, and I'm surprised that they haven't canceled, that haven't, they are showing coronavirus cases today because it's Father's Day, but let's get to the important points. So we're reporting 318 cases today, okay. So 51 cases are from the Waterloo region takes over again with 51. Because of course they got high cases. 49 from PH1 region, higher than also beating Toronto. 45 from Toronto and 26 from Ottawa. So all other regions are reported under 20 cases today, and so 12 deaths have been reported today. So variant have since it wasn't updated yesterday, we got the results today. So the UK variant is now at 142,113. Okay, that's more our major biggest threat, but soon to be replaced by the India variants. So the South African variant is at 1,154. Okay, variant. Brazilian variant is at 4,230. And the India variant is at, or the Indian double mutant variant, or the Delta variant, as its nickname, given by WHO. Although the nicknames are just useless. They're completely useless. Yeah. That is at 751 right now, so which is a big jump from last time. Because the last number was 586, now it's 751. So yeah, that's a big high jump. So vaccine bookings is 12 and up. You can pre-book shot 2 for those if you're 70 up. India or the India variant hotspot now, which the India variant hotspot is Pure Region, Halton Region, Porcupine County, Toronto, Waterloo Region, Wellington, Dufferin Gulf Region, York Region, Hamilton, Durham Region, and Simcoe Muskoka Region, which is the 10 regions currently that are like at the highest, with Pure Region, Toronto and Waterloo Region are highest at risk right now. So you know what to do if you want to like sort of sign up for vaccination, which will end up being a requirement, especially if you don't want to get affected by the India variant, yeah, you got to be fully vaccinated to be not get the India variant. So I got the phase 1 rules down below. So phase 2 will officially start July 2nd for majority of that's the earliest it could start for for regions to enter phase 2, but the requirement is 3 weeks. 70% of eligible people getting their first shot of the coronavirus vaccine, and 20% of residents getting their second shot of which is already a checkpoint that we already gone through, but the 3 weeks and 70% of people need to get their first vaccine. So that's a requirement for. So if the health unit find out, no, they're gonna it's up to them to choose when to delay for the region to move on to phase 2 or not. And I know some of you are itching to getting their haircut, and which is included in phase 2. So there's been a arousing question that Canadians are asking themselves, and so there is no wrong answer. No, there's nothing wrong with getting either the Pfizer BioNTech vaccine or the Moderna vaccine. Cause it's similar. So Dr. Peter Juni, the scientist for the scientist chief of Ontario, that he said with the interview with the West Blocks. So he explained that it's like how it's similar to how we view gasoline. It's basically that these two really are so close to the way they are produced, the concepts, etc. We know it. We know it when we look at the antibody responses. So they said that that's important to keep in mind. There's no better or worse between these two vaccines. So 68 million vaccines are set to arrive in July, and this month there's been a ton of deliveries from Pfizer Incorporated and Moderna Incorporated. So the proportion of eligible Canadians with at least one vaccine shot, getting one shot, has a sort of 70%, though. So which it only represents Canadians with 60% of the total Canadians with at least just one shot. And then the vaccine, there was more frustration, with the NAC, the National Advisory Committee on Immunization, NACI. They changed their guidance for so if someone got the AstraZeneca vaccine first, like as their first vaccine shot, they said that you could switch to the Pfizer BioNTech vaccine or the Moderna vaccine instead, which really brings back bad news for the Oxford AstraZeneca company that produces the AstraZeneca vaccine. And now the India variant surge started, and it stands poised to become soon to become the big highest threat in Ontario. So. So Dr. Peter Jenny said they did the right thing. So anyone who got the AstraZeneca vaccine, either as the first or second dose, and the vaccine remains excellent, preventing severe outcomes and death. No. So he said, what's happening now as the India variant is spread is evolution in real time, and that poses new concerns were not clear when less infectious and less severe strains were more common. And he said, we know the situation where the India variant is about to take over Ontario, for example, and we just need to react to it. Because in the United Kingdom, they're going through a problem right now, large problem right now, and yeah. So he said this evidence just clearly indicates yes, 2 shots of Pfizer or then also 1 shot of AstraZeneca, followed by 1 shot of Pfizer or Moderna, or just is a better choice to get this pandemic under control than keep it under control. Anything else? He also the rollout of vaccine also poses challenges for parents who might be able to get it fully vaccinated in the short term, but why worry about with the children when the unvaccinated children or fully vaccinated parents have to do a 14-day quarantine if they travel and also with travel, Dr. Peter Jr. You mentioned is that and that's my perspective that would mean if we travel with children, that the children would need to undergo this regular quarantine and would need to get tested repeatedly, not just once. And he also mentioned how we don't have vaccines that are approved for kids, and the only vaccine that is like 12 and up is the Pfizer BioNTech vaccine, approved right now. Because you can't do this with the Moderna vaccine or the AstraZeneca vaccine, because those are, especially the AstraZeneca vaccine, it is not safe for youth underage, under 18, and or people seniors above 65. That it clearly said that no, you can't do that. And Moderna Incorporated, we haven't heard about the results. Whether they can do the same thing for for kids, 12, underage, like the Pfizer vaccine. So Dr. Peter Juni, he's hoping to see strong uptake of vaccine so that the country can get the bench, get at least 80%, 5% of the population fully vaccinated. And so we're doing good. So yeah. And he also said that there's a low amount of vaccine hesitancy in this country, so and he hopes that it stays like this. So there's also so it doesn't really matter what vaccine you get, Pfizer BioNTech vaccine or the Moderna vaccine. Similar effects, no problem. And also, getting vaccinated right away, sooner is the problem. Is because of the India variant, which is posed as our new latest threat. And let's hope there's vaccines for available for use, and yeah, people get fully vaccinated soon. Hospitalizations. 266 people are hospitalized with corona, with the virus. They finally reported that one too. (333) ICU patients. 208 ICU patients using a ventilator. All are lower. Good. there have been no long-term care home updates. Still, that's the only one. So here's the data from June 18th. And the stuff has not changed since that stuff not changed since June 11th. And stuff does not change. And outbreaks, we don't know. It probably might be at 9 or 10. So please follow coronavirus safety rules and regulations and phase 1 rules. Don't have gatherings over 10 outside for the safety of others. No. Phase 2, you can gather outdoors 25 people maximum and indoors 5 people maximum. Now, sign up for vaccinations. And stay safe. You don't want to get the India variant.